Welcome back from the break. The National Tobacco Control Act 2015 regulates all aspects of tobacco control, including smoke-free places, tobacco advertising, promotion and sponsorship, tobacco packaging and labeling, prevention of tobacco industry interference, tobacco products disclosures, the creation of National Tobacco Control Committee, tobacco product sales, including prohibiting the sale of single sticks, among other areas. The National Tobacco Control Regulations 2019 implements many provisions of the Act, including smoke-free places, tobacco advertising, promotion and sponsorship, tobacco packaging, labeling, prevention of tobacco industry. And as the global community gears up to mark the World Tobacco Day, No Tobacco Day rather, advocates are drawing attention to the exploitation of the nicotine industry that is geared towards the youth in particular, and to advocate for policies to end this global tobacco crisis and the disease and the deaths caused by the epidemic. Interesting conversation we'll be having this morning. And joining me to put this discussion into clearer perspective are two key experts in their own right. First is the Executive Director of a New Thing International Foundation, Mr. Kenneth Aneto. And second is the Program Director from Bodies Care Initiative, Dr. Yemisi Adegboye. Good morning, guys.
Good morning. Good morning.
It's nice to have you. Interesting.
Yeah.
Conversation to have.
Very interesting.
But let me start with you. Now, statistics say that roughly 6 million people from tobacco-related ailments every year. And that number is projected to rise to over 8 million by 2030.
Exactly.
What's your take on this growing epidemic, particularly on the youth? Yeah. Let me put it that way. Let me start from you.
All right. So the thing about this interesting topic that we have to talk about without having to hide anything is that it's not just an epidemic, it's actually a pandemic.
Wow. And
if care is not taken, it is already a public crisis, a public health crisis that is affecting every sector, not just the health. Yeah. So I'm here as both the doctor and the mother. Okay. So I'm going to be talking from the mother's perspective, okay, because our children are in danger. So if this nicotine is targeted towards the next generation, yeah, so we should begin to think, what exactly are we doing? Or we should begin to look at the cause of the effects on the next generation. So it means at the end of the day, yeah, many other things are affected: the economy, the social life, their mental health, and everything about even academics, their productivity. Every other thing will be affected. And the numbers are growing. Statistics have shown, even science has shown, that the number will grow if nothing is done about it to curb the effects. And it's an action we have to take swiftly, without delay.
Interesting.
Yeah.
I like where you pointed out that the numbers are growing. Yeah. And how do these numbers grow, Mr. Kenneth? Is vendors who openly sell vapes and tobacco to underage kids without consequence. What do you think we deterred vendors from selling to underage children, knowing fully well that they are underage children, and you open your eyes in broad daylight, sell to an underage children to smoke tobacco? That's ridiculous. How do you describe that?
I'd like to say thank you again for this opportunity. I'm so glad that an issue that has been championed around the nation has come to public light, and having the media take it very seriously is important. Personally, our organization has been involved in a lot of sensitization campaigns in interior communities, and we see that how free it is for underage kids and everyone to access some of these items, even access vapes. It's actually alarming. And I think it's time that we need to start putting stringent measures to checkmate these people. Let's just see how can we address this issue. How can we have sting operations for places where they sell this to minors or sell it to anybody over the counter? How can we begin to publicize the enforcement How can we enforce, as we are having these sting operations, can we have recordings? If you remember, there was a time that there was a documentary on substance abuse and they showed sting operations. Can we publicize like this? Can we get the people that are doing these things to now start feeling, okay, there's something attached to this? Can we prosecute the people? Can we prosecute them openly and publicize it? Thank God we have the media now. Yeah. Can we publicize us persecuting them? And can we create steeper measures that will address these issues? I believe that will go a long way to helping them bring out their moral compass, because a lot of them are profit-driven.
Before I come to you, you know, one thing that's very funny is that I think growing up we used to have that advert. I'm not sure if you still have it.
Smokers are liable to die.
Smokers are liable to die.
Yeah.
I don't know if it still exists now. But when you go to public places, for example, guys who go to club, you know, you find all of these there. And if indeed we are very serious about clamping down on all of these things, don't you think that places like that will also be affected and business will be affected, you know? So how do what are the things that we need to do to make sure that this does not go out of, she said it's now a pandemic, not an epidemic anymore. How do we go from curbing that particular scene where young men and young women who find themselves in that bracket move away from it?
Okay, let's look at the context of what we're talking about.
Yeah.
We're not saying, we know that everyone has a right.
Yeah.
And we're not saying that everyone don't smoke. Yeah. We're saying that we have to stop the targeting and the initiation of young children into smoking. We're saying that some of these companies are creating flavored tobacco products, vapes, to actually target the young ones, to initiate them into smoking, and now have a new market with the guise of saying that taking vape products, that those vape products are products that will help you stop actually using tobacco and stop using nicotine products. But actually, the campaign is to target the younger ones. And we're saying that, okay, there are different types of laws and different types of restrictions. Yeah. There are smoke-free places. There are smoke-free laws. And in those kind of places now, we're saying that we don't want people to actually be using vapes too. That we have to look at the way that we can create these regulations in which that vapes and other of these tobacco products can be included in those restrictions. Because when young people see people vaping like that in open places, it becomes a challenge and encourages them to want to vape.
I'll throw the question to you, and this has to do with how this nicotine thing, works. And I'm trying to understand, how, what can we do, to mitigate against this?
All right. So please just give me 1 minute to talk about something.
Yeah.
One of the reasons why we don't want early initiation is because when they grow older, they can make informed decisions.
Exactly.
But as children, they can't make informed decisions. So whatever you bring to your table, I call it like brainwash, to let them know this is not harmful, it's just flavored, this has nothing to do with your body, you can still cope with it and all of that. So they're still young. They're unable to know what they should do with that product. So if we say increase the initiation of the age, it means we are hoping, that's the word, hoping, that by the time they get to a certain age before they are being introduced to it, they can make informed decisions on what they need to do. About peer influence, about the pressures that come from them, and the social media and all of that. Now, when we talk about nicotine also, the thing about nicotine is that nicotine is nicotine. Whether it is in the vape or shisha or whatever form it is. Now, the world is evolving and the world is dynamic actually. But the thing about nicotine is revolving. Let me take it again. The world is evolving and the world is very dynamic. That's why we're looking at, okay, let's change the forms of this.
Okay.
But the thing about that is that whatever they are doing is just revolving because we are just going around the same point.
Okay.
It's still the same cycle. The way out is to stop it, to put a clip to that. Now, I did something about healthcare financing in my PhD. And the thing about finances, when you talk about business, affecting businesses, is that when we talk about money, it's not just the literal money. There are some other things we do not calculate. Like when we talk about affecting their business, it's not just about the business effects that we should look at. We should look at what are the other things that are affected. If it affects the health, they pay for health. When they don't go to work, they miss time out from work, so it affects their productivity, and then it affects the economy at the end of the day. It affects family life, it affects their profession, it affects every other thing. So if we are to literally sit down to actually calculate the effect and then weigh it, we will see that that literal one we just see as affecting their business is small in percentage when we calculate the percentage compared to the overall effect. And that's what we should be looking at, to let them know it's not just about your business. Because by the time we calculate every effect of it in money, we will see that it's not something we should even joke around with. So, fine, there are way out. When they come to the hospital, there are ways, psychotherapy, they see the behavioral scientists, and then there are some drugs we call nicotine patches and all of that. Those are the medical things that can help. But telling them to move from cigarette to something that is attractive and looks pleasant to them is not the way out.
Interesting. Mr. Kenneth, one of the fastest way to advertise any product now is on social media. That's one of the fastest way you can advertise a product now. So if you look at, in this case, what specific policy reform do you think that we need to have to prevent us advertising tobacco on social media? Because it's a menace. What do you think?
I think we have to look at we have to look at our advertisement laws on how we can curtail online publicity of these materials. How can we begin to address those type of things? How can we begin to have the opportunity to be on other platforms when they're talking about sanctioning some of the what's that word, influencers that publicly advertise this type of things? And apart from curtailing that, we have to look at another way. Parents have to become digitally aware.
Exactly.
Aware of the type of content that children are consuming, aware of the people that their children are following, and look at the way that they can learn about safety, online safety for their children. So it goes beyond only the responsibility of the government to create the policies, but also the parents have their own part to play to learn about online safety and how they can watch the type of media that their children are consuming.
You as a mother.
Yeah. Thank you. Let's talk about that.
Yes, you as a mother. What best way, maybe you share an experience. What best way do you think that we can help curb this, children having to be on social media almost every time, to have this not being looked at on social media?
Yeah. So the thing about social media and real life experiences, I would like to compare it as a mother. Now, for schooling these days, many of the things they do is digitalized. So you have our children have phones, they have their laptops, they have their tabs, they have all kinds of gadgets because they have to do schoolwork and have to meet up with the world because the world has moved, right now. So the thing there is, like you rightly say, is to teach them what to do, what to know, how to go about the course and how the world is moving. Because you cannot restrict them. One thing I practice liberal parenting. So I let them see all these things, let them know what it is now. Because they will not always be with me forever. So once they leave, they will be exposed to all of that. So it's good they see some of those things. We talk about it and say, this is this, this is this, that is that. Then I see how they think. I monitor what their views are and their perspectives about those things. So I can correct them while they are with me at home because they are young. Because they will still leave me and go to their own private spaces and they'll still have all these gadgets.
Yeah.
I also need to know who their mentors are or who their models are. You know, children, oh, I love this person, this celebrity and all of that. And I see that celebrity online smoking or doing his or her videos. You know, they do some of these videos, music, and they're smoking and all of that. So I need to begin to, so that's where parents, in fact, all these things start from home. Like I was on another show on smoking and I told them there that it's a national stuff that it's not just the government, it's everybody. We all, the religious homes, the private organizations, the media, just like we're doing now. So we cannot hide them from knowing these things. The earlier they know and make informed decisions, the better. Okay. But where I was talking about the initiation, where the government comes in, is that they can increase the age. By then, they would have gone through some processes to make such informed decisions.
Mr. Kenneth, you were speaking about how what your company does in terms of how you help underage kids. Tell us more about it and why you feel that it is very essential at this point in time, because just like you said, because when they grow up, they're going to make informed decisions. But tell us how that process goes and how it will help curb this menace that we have currently.
Okay. Thank you again for that question. And our organization, the Unity International Foundation, believes that when we share facts, we save lives. So instead of going to tell kids that when you do this, you will die, when you do this, this will happen, we give them the right information and allow them to make informed choices, as Doctor said. So for the actually in July this year, we'll make it 10 years since we started going from different communities, sharing information on the
And how has that been?
It has been a journey.
Yeah.
It has been a journey, a learning experience, and we've had amazing opportunities. We've been trained by different organizations. We used to at first say that smoking kills, this thing kills, that. But a while ago, over years, we were trained by United Nations Office on Drugs and Crime, took some courses at Harvard, and did other things to improve our capacities and share the right information. And we've been opportune to see people grow, opportune to consult with the Senate on drugs and narcotics, been opportune to do a lot of work. And the truth of the matter is that, as Doctor said, these kids will be exposed to these dangers. The best you can do is give them the right information so that they make informed choices. When you look at kids in their early age, their brains are still developing. They call it neuroplasticity. And in that time, the critical areas that are responsible for decision making are still developing. So when they use substances like that, it can destroy those areas. And there are statistics that show that if a person doesn't use substances between the age of 13 to 25, they're less likely to ever have an addictive attachment. So it's important we begin to act now. It's important that every stakeholder in intervention gets involved, and I'm happy the media is being proactive about this.
I like the fact that when you said when you put out facts, you save life.
Yes.
That's very fun. And there was something that you said which will bring me to you, Doctor. What you said about when they met Senate on these. Now, what steps do you think that lawmakers need to take to strengthen the National Tobacco Control Act? All right,
thank you. You see, the thing there is we have laws, we have acts, we have many things. The major problem we have is implementation. And the reason is because we have different people who have different opinions, different perspectives, and overall goals. Personal objectives, personal goals, personal gains. And if we continue that way, we will never get anywhere. So this is part of what we need to do to ensure that this is not a matter of personal gains or personal goals or personal views. It is something of the national crisis that we need to curb. Also, I'm particular about when people go to mall to even shop for groceries. All these things are there, displayed.
Displayed.
And I wonder, what is all of this to do with I will need to buy my normal things? Because the children go for shopping and they see it there. And they think it's part of the normal household shopping. I'm a mother. So when I enter the shopping mall, most of the shopping malls is just by the entrance.
The door, by the entrance.
So as a children, because you want to also expose the children to some of this, so you go for shopping, they pick things, and then when a child enters the shopping mall and the first thing the child is seeing is all of those things by the door, it speaks a lot of volume. The second thing is, for those who don't even have opportunity to go to the malls, on the streets, they are there. No regulation. So what I will plead the government to do is that they should not just place regulation on the cigarettes. They should also place regulations on the upcoming nicotine products, the vapes, the shishas, and all of that. And also reduce the public spaces where people can smoke. So when they reduce the public spaces where people can smoke, then it reduces exposure.
Okay. Yeah. Interesting. There was something that you said, and you made me adjust. You know? That when you go to the mall, you even say it, you just stick to my head. Truly. And that brings me to this question. You know, this is an urgency for Federal Competition and Consumer Protection Commission, FCCPC. What immediate action from agencies like FCPC would you like to see in such cases? Because, you know, she just painted that picture in my head, and I felt like, okay, Mr. Kenneth, what do you think?
I think that they should begin to review these products. They should begin to make sure that the dangers are well put out there.
Exactly.
I believe that they should look at checkmating organizations where people can get easy access to this product, because sometimes
say it. No, say it.
It's a lot.
There are times that even kids can get access to these products. Anybody can walk into some places and just get access. How do you checkmate this? That's what brings me back to sting operations. They have to begin to see how they can have sting operations to shut down places where minors can get access to these products without proper regulations. Growing up, I was opportune to travel a lot. Growing up, my parents moved a lot, so a lot of places, I would see places where kids could just walk in and have access to products they were not meant to have access to. But I know my visits to the UK, I would be in shops where some of these products were displayed, but a kid could never get access to them. They will always ask you for ID card, they will always ask you for this. So it's a cause that even as Nigeria is developing, as we are growing, we need to begin to watch how other countries, what are the measures that they are putting in place to safeguard their future, to safeguard their minors, and begin to imbibe those type of things.
Interesting. My last question, and that has to do with you as a mother and also an advocate. What is your final plea? So while you answer this question, I'll also throw it to you, but what's your final plea to policymakers to treat this as a public health crisis and prioritize Nigeria's children over what I will call industry profits? So you answer my question. So you answer my question as a parent. You answer my question as somebody who is
advocate.
Exactly. Okay, that's that.
So my plea to the government is to further tell us, people, children, the education sector, the health sector, not just a plain message that smokers are liable to die. They should go a bit further. There's something we call information, education, and communication. That's a complete way. You know, it's a complete cycle of what can be done to help the children. So we have the Ministry for Information, we have NOA, we have all of that. So rather than just saying we've told them to put it on label and that's enough, we should go a step further to ensure that we are actually doing information, education, and communication. By that way, it will help. The second thing also is to ensure we begin to do something on BCC, behavioral change communication. So all these things will go a long way to help, because these are ways in which you can help people, you know, from their psychology and all of that. And then I also want the government to also know that it's not that liable to die young, because many people say if something will kill a person, this is Nigeria.
And something will kill man.
Something will kill man. So the nicotine effects affect people from their head to their toe. So every part of the body is affected. The brain, the eyes, the mouth, the nose, the respiratory system, the heart, the reproductive organ, the immune system, their bones, everything is affected by this. So my plea, my honest plea to the government is to reduce exposure, reduce access, reduce the availability, ensure that they enforce and ensure that they put out more effort on information, education, communication, and behavioral change.
Thank you so much. Mr. Kenneth, the last word.
When I speak, I don't just speak as an advocate. I speak as a strategist, and I speak as a consultant that works with legislators, work with the Senate, and work with different MDAs on substance abuse programs. I want to let people understand that the challenge of nicotine is not just about the challenge of smoking. We'll have to look at it as a gateway drug. And when we look at it as a gateway drug, it opens up a lot of possibilities of being able to possibly lead to addiction. And so, when you look at that now, this is not just a call to regulate, a call to sanction, or a call to ban. This is now a call for the soul of Nigeria, for the soul of our children, for our future. So when we look at someone vaping, it's not saying that everybody that vapes is probably going to switch and go into something. But for that person, looking at the statistics of substance use in the country, you understand that for every 7 Nigerians, 1 has a substance use challenge. And most people started off with just cigarettes. So when we think about enforcing, about sanctions and acting, let's think about what our future is going to be.
Thank you so much. Thank you. Kenneth Aneto, thank you so much. I really appreciate it. Doctor, thank you. Thank you. I really appreciate it. Thank you.
Being here.
I think I have more knowledge about this now. I have more knowledge. And everybody should be able to do that, you know. Say something to anybody who you find taking these kind of drugs, especially when it has to come to nicotine and underage kids. Thank you so much. I really appreciate it. Thank you. And of course, let's do some entertainment news in yet another devastating